Good afternoon, and thank you all so much for being here and coming at the 11th hour. I know when we sent out the advertisement for you to come, we mentioned that it was critical times in the city of New Orleans. I'm joined this afternoon by Dr. Jennifer Avegno, who is our director of our health department, Dr. Emily Nichols, who is our director of EMS, Council President Helena Moreno, Ramsey Green, who serves as our Deputy CEO of Infrastructure, and I also have Colin Arnold, who serves as our Director of Homeland Security, of course, for the City of New Orleans. We stand before you today, agreeing at a critical moment in our city. And thanks to the Delta variant, the COVID pandemic is once again raging out of control. As of today, there have been 35,115 cases and 814 deaths reported in our community. Over 1,000 new cases in New Orleans just over this past week. Over 1,000 cases just over this past week, and heading over 6 deaths in our community. The average daily cases from 104 last week to 272 this week. This is a very dangerous number. We have been here before. We've seen the movie over again. And what was once unpreventable, today it's preventable. And it's through our people getting vaccinated. Our positivity rate is now at 10.7%. It was 6.5% just 2 days ago. This touches everyone in our community, but with a very laser focused on young children in our community. Our children are dying. From 2 weeks old to 2 years old to 4 years old, you cannot make it up. Our children are dying. Today I'm issuing a mandatory mask up, NOLA, a mandatory mask for the city of New Orleans. All of our people need to mask up when they are indoor, and it's always been, if you're in large crowds in our city, over 500, you're supposed to have that mask on. But what we're saying now, you really need that mask on, period. Whether you are vaccinated, and of course, if you're unvaccinated. This is for all, again, individuals in our community, vaccinated and or otherwise. I'm asking also that city employees, moving from that incentive base to mandatory vaccinations for city employees. I reported that the city of New Orleans has been doing very well at over 71% of our employees who are vaccinated, but that is not good enough. We want to get to 100%. And we want to be the example for private industry as well in our city, pushing mandatory vaccinations. This wave of COVID has hit our people very hard. And as I mentioned, even from the onset and what we saw, one of our primary and premier public safety agencies, EMS, was hit very hard with COVID. We're experiencing that this week, today, right now. And what that has now prompted me to do is sign an emergency contract that therefore allows the city of New Orleans to increase our capacity on the ground, because we currently do not have the capacity to respond to 911 calls that come from our community right now. So when Dr. Nichols, our director, sound that alarm, of course, without hesitation, we've moved forward through legal to take these steps to ensure that we have the capacity to respond to our people in a timely manner. Thank you, Dr. Nichols. Thank you so much, Dr. Avegno. The state has informed us that they do not have the capacity as well in terms of leaning on the state for additional capacity. Therefore, I have no choice to move forward with an emergency contract. And that is routed through our Office of Homeland Security. We've been saying the same thing over and over and over again. None of this is new. But what we know, again, what's not new, we know how to do what's right to address public health and public safety concerns in our city. And now we're leaning again back on the people of our community, on the business community, to follow the city's lead in ensuring that mandatory vaccinations are required for your employees as well. Ramsey will speak on what we're requiring as it relates to the contractors doing business for the city of New Orleans and working in public spaces around the city, also being required to get vaccinated. So with this, I'm going to turn it over to Dr. Jennifer Avegno. You'll hear from Dr. Nichols. You'll hear from Ramsey Green. And as always, I'll offer our councilwoman to say a few words as well. Dr. Avegno.
Yes, ma'am. Thank you, Mayor. As the number of new cases and the staggering number of statewide hospitalizations have shown us this week, as the Mayor mentioned, we are facing a much more dangerous virus in the Delta variant, and we must take immediate action to slow the spread. The Delta variant of the coronavirus is known to be more contagious and more deadly than the original strain of COVID. To put it in context, it is more dangerous than smallpox, it is more dangerous than polio, and it is more dangerous than Ebola in terms of contagion, right? Spreads more quickly than smallpox, polio, and Ebola. Sorry, I misspoke. I didn't mean to say more dangerous than Ebola because it's not, but it's getting close. It spreads as easily as chickenpox. Anybody who is a child before the chickenpox vaccine came out remembers that if you were in a room and one person had it, then everyone had it. So I want those of us who can remember that to understand what that's like, and parents, tell your children who don't have to go through that because they've been vaccinated. So we have a disease that is far more contagious than the original strain. This is not where any of us wanted to be or hoped we would be in our worst nightmares. We only need to look at any one of our hospitals to see its effects. Over 1,700 people right now are hospitalized for COVID, just COVID, across the state, up from 250 at the beginning of the month. We are on track to beat our statewide record of COVID hospitalizations in 3 days. And that was seen this winter. That will be higher than what we saw during the worst of March and April last year. Hospitals have shut down elective procedures. Emergency departments are full. And the Louisiana Department of Health is once again looking to contract additional hospital beds to treat the rapidly growing number of severely ill Louisianians. As we've seen throughout the pandemic, we know that the deaths lag cases and hospitalizations. We did not have a death for weeks. And this week alone, in the last few days, we've lost 6 New Orleanians. So this is real. This is not just a few people getting the sniffles. We've been here before, and we know what works. Nothing has changed in terms of the mitigation measures that work. So as the mayor said, effective immediately, masks will be required in all indoor settings in Orleans Parish. When you are indoors with anyone who's not a member of your immediate household, please wear a mask, vaccinated or unvaccinated. This includes all businesses in Orleans Parish. And I want to thank our business community because so many of them, storefronts, venues, clubs, DJs, performers, have already instituted policies designed to ensure the safety of their staff and customers, and have gotten, I think, overwhelming support for doing so because that's what people understand we need to do. Masks are a very effective tool to slow the spread of COVID-19 regardless of the variant. But let me be clear, the vaccine has been and will continue to be our way out in the long term. 90% of people hospitalized for COVID are unvaccinated. And 90% of the new cases reported to the state last week were unvaccinated people. I don't know how much more clear the data can be that getting the vaccine significantly reduces your chance of contracting COVID, getting severely ill, and dying. This is a preventable disease. It was not a preventable disease last year. In New Orleans, 71.4% of our adults have gotten their first shot. That is a tremendous number, and that has gone up several percentage points from last week, which is fantastic, and thank you to everyone who's done that. But our young children can't get the vaccine, and unlike previous surges, they are filling our pediatric hospitals statewide and our ICUs. We cannot fail to protect them now when they need it the most, and when protecting them is as easy as a piece of cloth and getting a shot. We need to implore the remainder of our residents and those visiting our city to get the vaccine and to mask up in the short term. So I'm asking, again, every single vaccinated New Orleanian, tell their story to a family member, a neighbor, a colleague, somebody in the grocery store, somebody in church. Vaccines are safe, effective, life-saving. Until we reach a level of immunity that protects us as a community, all together, we need to continue these mitigation measures to control the spread. And masks are the critical part of our short-term response, right? This is something that can be immediately effective, unlike a vaccine, which takes a few weeks once you get it. So we need a long-term play and a short-term solution. With so much viral transmission out there, this is crucial to keeping us safe until we're fully vaccinated. So thank you to everyone in New Orleans who've masked up, who've gone sleeves up. Let's come together. We know we can do this and keep each other safe. Thank you.
Thank you, Dr. Avegno. Dr. Nichols? Yeah, balance it out. Don't leave the councilman.
So I just want to say thank you, Mayor. Thank you, Colin and NOSEP, for working with New Orleans EMS to ensure that we can establish a local contract to assist our first responders. Our EMTs and our medics have been working endlessly for a year and a half now through this pandemic, and we're stressed nationally. We are limited in resources nationally to the point that when we are looking for surge ambulances, they're not always available. And so we have been working today and for several days to mobilize units and shift around so that we can continue to respond to the need. But this is something that we have feared from the start of COVID. We have spoken many times about this virus and the uncertainty of it. And that is how virology, the science of viruses, works. These viruses are practicing Darwinism. Anything that we do to let our guard down, if we don't all mask, if we don't all get vaccinated, the viruses are mutating to find ways to stay alive and continue to infect us and continue to kill us. This is an ongoing fight that we cannot win if it's just a few of us that are accomplishing this. Please continue to take care of yourself, to preserve the healthcare industry. It is so critical, and also to preserve the safety of your neighbors. What we're finding is that parents are fearful. They don't know who to trust because they don't know who is truly vaccinated, who hasn't told them that they actually have some symptoms. Parents are fearful that they cannot protect their children. We owe this to our neighbors to vaccinate, to stay safe. This is the only way we're going to overcome this vaccine. So I thank you now for doing what we need to do, for stepping up for our survival. Thanks.
Thank you, Dr. Nichols. Ramsey Green?
Thanks, Doc. Thank you so much, Mayor. Thank you, docs. You know, in the last 48 hours, the information we're seeing is jarring. And one of the most effective ways that the city is going to push the spread of vaccinations is mandatory vaccinations for all city contractors. At this moment in time, we're spending $1 to $2 million per day. That's every day of the week, Monday all the way to Sunday. $1 to $2 million a day. If you are on a city job site, if you are on a public right-of-way project, if you are in one of our buildings, your personnel will be required to be vaccinated. The details on that are coming out next week. At this moment, a memorandum is being issued to every city infrastructure contractor explaining the details of that. This new variation of vaccine hitting children and people who have no choice but to be vaccinated, whether they have an immunosuppression issue or whatever, there's no excuse. None whatsoever. And if you want to work for the city of New Orleans, get your team vaccinated and do it now. We've notified the Sewage and Water Board, we've notified the Army Corps of Engineers, we've notified industry, including the Associated General Contractors, the American Institute of Architects, and the American Society of Civil Engineers within the last half hour. We've also notified RTA and the Sewage and Water Board to ensure that their contractors follow the recommendations that we are doing as well. Thank you so much, Mayor.
Thank you, Ramsey. And offer to you, council member. I'll be brief.
Thank you, Mayor. I stand with you to support what you're doing here today, as does the council. Once again, I mean, this is a critical point. We are in a life and death situation again, and these are life-saving measures which the city is putting in place. I mean, I think anyone, that you talk to these days in the city of New Orleans knows someone who has COVID at this point, or a family member who has COVID at this point. So it certainly is spreading very rapidly and dangerously throughout our community. I think that this mask mandate once again shows the true leadership of the city of New Orleans to protect the people who live in this city and to keep them alive. And I just hope that the state of Louisiana follows suit, because it is not just in New Orleans where cases are surging. They are surging throughout the state of Louisiana. So I'm hoping that a mask mandate follows for the state as well. So please, to the people living in this city and to those visiting our city, please get vaccinated and please wear a mask. Thank you.
Thank you so much. Thank you so much, council member. Ms. LaTanya.
If you can elaborate on the timeline for city employees requiring them to get vaccinated, how long? Do you have an estimate on how many people still need to be vaccinated within the city?
Right, so we're a little over 71% that are vaccinated. We have over 4,000 employees. And of course, when you think about departments, it's multiple. We initially, with our incentive program, gave our employees up until October the 15th to be vaccinated. Of course, that's off the table. The incentive will remain on the table. However, the requirement is effective immediately, and more details will come out on Monday. I had the opportunity to reach out to Civil Service Commission, our director there, because civil service, the commission can actually mandate this. They have the authority to do so on their own. But I let them know that this was the route that the city was looking at taking because of the current and existing conditions that we're seeing relative to this Delta variant. So more information to come in terms of the specifics related to mandatory vaccinations for our city employees, but that is effective immediately. Vaccines are available right now. And just like we set up shop, in the lobby and in various city departments or agencies throughout the city, we'll look to do the same.
Just follow up if I may. For those city employees who are hesitant, are worried about losing, are you worried about losing some city employees who don't want to work for the city anymore because they need to get the vaccine? What would your words of wisdom be?
Well, I'm worried about losing city employees as it relates to death due to this virus. And it's bigger than one person. And we're only as strong, right, together. And it speaks to the need for city employees putting on that burden of public service and the sacrifices of public service. It does require us to be vaccinated. And we're in the midst of hurricane season, cannot forget that. Also, of course, pushing for our kids to be back in school as well. But in terms of hurricane season, emergency preparedness, we're in the throes right now. We need to be prepared to respond to the needs of our community every step of the way, and right now, that is through being vaccinated.
WGNO and lastly, WDHU. Do you foresee issuing any stricter guidance on capacity limits at this point?
At this point, that is not something that we are putting on the table. However, everything will remain, on the table in terms of consideration, depending on how we are in terms of the existing conditions that we face from day to day. We continue to manage or monitor the data that will drive the decisions that come from my administration. And so we'll continue again to look, but at the same time, urge our business community to do what's necessary so we will not have to take those types of precautions. We know that we don't want to regress. We do not want to close down. We have turned the tide in terms of our economy, getting people back to work, business and industry functioning. We want to maintain that, but the city of New Orleans can only do so much. but we're urging the private sector, the business community, to go the extra mile so that we're all doing everything that we can possible to protect our people as well as our economy. But this is about our people.
And I mean, a quick follow-up. As far as enforcement of the mask mandate, what will the city be doing?
We'll do what we've done previously, which is still a heavy burden for city employees that have been in the trenches for 18 months now. So when you think about the capacity and the capacity issues, they are real. So this will be a challenge for the city as it has been, but we will do everything possible to ensure that people are held accountable. But personal responsibility is number one. So we're setting the tone, we're setting the level of expectation, and we encourage people to follow it, do the right thing, but we will enforce as best we can.
Last question, DSU. Just when it comes to the mandatory mask, indoors.
Yes.
What about outdoors? Are you recommending anything for residents when it comes to outdoors?
Well, our doctors are saying you need that mask on, but absolutely indoor. Outdoor, we've had the mask requirement if there are groups or gatherings over 500. We're encouraging and advising people to mask up. And in terms of the mandatory, we're looking indoor first. And absolutely, when you think about those large gatherings and even small gatherings, I mean, that's what my doctors are saying too. So we want to just put out there that people should put that mask on, but relative to the mask up mandate, we're looking very heavily indoor.
And I know a lot of these festivals and events haven't been canceled, nothing,
Right.
no changes with that.
Right.
Are you recommending anything for upcoming events?
Well, hey,
Any changes?
well, we will see. I mean, just like we have Satchmo this weekend, and Satchmo is requiring masks. Their events that are indoor, of course, they're listening to us now in terms of even outdoor, the large gatherings, and we will tweak based on the needs and the data every step of the way. So right now, we're wanting to focus on where we are, and we see results, and hopefully we'll continue to see progress.
Thank you all.
Thank you.